One person, two.
1, 2, 3, 4.
Okay, thank you. Hi everyone. Today I'd like to talk about the new superbug, the carbapenem-resistant antibacterialase, known as CRE, and how important it is to wash your hands. I have a little poster board here about our policies here as far as foaming in and foaming out in between patient care. And then of course I have some information about CRE, the new superbug, from guidelines from the CDC as far as infection control and washing your hands and stuff. So I'm going to talk a little bit more about measures that we can take to reduce the risk. It's not every day that the CDC makes an announcement to the public to let them know that we have a serious problem. I'll tell you a little bit about carbapenem-resistant antibacterialase. It is spreading throughout hospitals and nursing homes in the community. The mortality rate of patients that do contract the CRE is 50%. Right now, the CDC came out and said that they are not creating any new antibiotics to treat this. So this is where hand washing and making sure we have proper infection control in place plays a big part in this. CRE is part of a large family of gram-negative bacilli, which is normally found in our gastrointestinal tract. This is a group of bacteria that is part of a large group of the multi-drug resistant organisms. So some preventative measures to take when dealing with CRE is, of course, hand washing for 20 seconds with soap, placing a sign on patients' doors before entering. You need to see the nurse's station before entering. You need to wear precautions where we wear like protective equipment. And of course, if you ever go into a patient's room where you have to wear a gown, it is very important that you wash your hands with soap and water for at least 20 seconds. They say you can sing the happy birthday song, and that's how long you've washed your hands for. According to the CDC, in 2011, one CRE strand was seen in one hospital. In 2012, 200 hospitals over 42 states have at least one CRE infection. There are now 37 different CRE strands. 15 have been reported in the last year, and in 2012, 19 people died from the CRE strand called Klebsiella pneumoniae. CRE has been known to target patients whose immune systems are compromised and also those who have any kind of medical device pertinent to care. This is as simple as an IV, just having a little peripheral IV, and it's an open port for this wonderful bacteria to go in. Knowing this, that's like, everybody in the hospital. This is even more important that hand washing is done. We have our little famous saying, foam in, foam out, or gel in and gel out. There was a case study by Dr. Frieden in the state of Florida where a facility had an outbreak of CRE. 40% of its patients contracted CRE, and Dr. Friedman and the CDC, they went into this facility and found that improper infection control was in place. Nobody was following the hand washing techniques, and nobody knew that when they got the patients from the hospital, when they were admitted, that they had CRE, so they were not on any kind of precautions, and it was just kind of spreading. Once they came in and implemented all that, the rate of the spread went down to 0%. Wow, that is amazing. How 20 seconds of hand washing can go a long way. So can identifying and isolating the bacteria. So with that being said, we need to educate our patients, our families, and everybody on hand washing, hand washing, hand washing. I'd like to thank you all so very much for listening to my speech today, and of course I put together a little bit about some foam in, foam out hand washing techniques and some stuff from the CDC. So thank you guys.
Thank you.
Thanks.